Crispino, TNO Citizen TV.
Tonight we talk about a rare but highly treatable cancer. It's a pregnancy-related cancer, and it's known as gestational trophoblastic neoplasia, or GTN. In Kenya, many women face delays in diagnosis and limited access to specialized care. And tonight we speak to Rhoda McKenna. She's a survivor who shares her journey and also highlights the gaps in cancer care in the country. Rhoda, thank you for speaking to us. I want to begin by, this being GTN in itself being a very rare and little talked about cancer. Share with us a little bit about how you came to know that this was actually the condition that you had.
Thank you, Lillian. I'm here to talk about a rare type of cancer which not so many people have ever heard about it, including me, who was suffering that cancer. But it started one day with bleeding. It is caused by the pregnant tissues. I started with a lot of bleeding. Me, I didn't know. I thought maybe it was something normal for women, because as women we assume a lot. Then with several examinations from the doctor, that's when they noticed I have that type of cancer. And the main diagnosis was done at Kenyatta National Hospital. That's when they told me I have GTN cancer.
The world observed World Cancer Day this week, and a lot of Kenyans have experienced challenges in terms of accessing care. What was your experience like?
For me that time, it was NHIF. And NHIF really came in during chemo time. The only challenge was when I was going for this test, because most of the time I used to do a chemo 1 week, then I go home for another week for that medicine to work, then I go back. And before I start another chemo, I used to go through several examinations, but that one now outpatient, SHA didn't cover. But when it came to inpatient, they cover 100%.
We've talked a little bit about insurance, but in terms of treatment costs, how did that affect your ability to access care in cases where, for instance, we've known that people have experienced challenges even with the current SHA? What was your experience?
Cancer, it's very expensive to treat. So my challenge, most of the challenge was finances and trauma. Because sometimes Kenyatta Hospital, they used to have medicine, but in that combination, at times there were no drugs, there was a challenge of drugs. In combination of 5 drugs or 3 drugs, maybe 1 drug is not there. So you have to go an extra mile and get that drug from outside. You send your family to bring. And in case they don't have money, maybe that session you're not going for chemotherapy. It was a challenge, and other times, when you want to come back for the next treatment, maybe you don't have that money for these tests, and they're a bit expensive.
You talked about not knowing what you are suffering from and eventually being told about this rare cancer. Along the journey, what did you learn about this very rare cancer that perhaps women overlook?
What I would tell women out there, don't ignore anything small in your body. Because like me, I ignored them bleeding, and I called a friend and asked her, I'm bleeding, what should I do? She told me it's menopause, even it comes early. So I kept on looking forward towards menopause. But when it persisted for like 6-7 months, that's when I decided to go to hospital.
After this diagnosis, talking about the specialized care, do you feel that the care that you were given right here in the country was adequate? Because we know medical tourism is also on the rise. Did our Kenyan healthcare system handle your situation adequately?
My case was handled adequately, and it's only one time I missed the medicine, but this other time it was there. Though,
what type of treatment were you going through?
I went through chemo, and after chemo, I stayed like for 6 months. Then I went for surgery.
The whole experience, treatment, walk us through that.
Chemo is brutal. For me, the chemo I was doing was through injection. for 5 days, 5 consecutive days. But I'm happy these days we have even oral chemo, but me that time I didn't have a chance of that oral chemo I went through, and it's not easy.
Yeah, so there's been some advancements. There's oral chemotherapy now.
These days there's an advancement of oral chemo, or you just go for a day. Yeah. They put 2 chemo, then you go home. Yeah.
Now, what would you like to see improve as regards cancer care in the country? And also, as we close, how are you now? How are you feeling? Are you cancer-free?
What I will tell the government, kindly provide medicine, enough medicine for cancer treatment, and have counseling centers. Because Lillian, after treatment, everyone walks away. That's when it hits you. Hey, I was sick. That's when depression comes. But this time, everyone is surrounding you. They're giving you that care. You are relaxed. But after the treatment, everyone walks away. That's when it hits you. So I would request the government, you can have that after treatment. The counseling centers, patients can go there. They are taken through they realize the year I was sick. Then they can be given counseling, because it's a process, and it's not. And
how are you now?
Now I'm okay. After the old treatment, we came together with Kenyatta National Hospital. We started a support group to support other women because of what I went through. Lillian, I understand a cancer patient more than someone who has never been through cancer. So if a patient tells me what they are going through, if I see patients behaving the way they are behaving, I understand more because I was there. So we have a support group. We meet at Kenyatta National Hospital. We work together with Faraja Cancer Center. They are our supporters. So we support our patients, we visit them, we create awareness, because this is the type of cancer which is not known by so many, and there are so many people hiding there. Because the way it comes, it's like people fear that bleeding, that shame. Maybe someone might think you are aborting, someone might think you are doing something bad. So we are creating awareness to the society, to the partners, and to the patient themselves to come out and speak and go for treatment.
Right.
Yeah.
Thank you, Rhoda McKenna, for sharing your journey with us as the world observed World Cancer Day this week. We'll be right back after this break.